this is our presentation on the YCS Umoja Health Peer Leaders. And in our presentation, we will be talking about the background of Umoja Health, the peer leadership program, actions taken during the program, about the survey, the strengths of the program, and its impact on peer leaders. And here's some background on Umoja Health. So the intention of Umoja Health is to increase vaccination rates among communities of color and identify needs related to the COVID pandemic. And Dr. Kim Rhodes began the Umoja Health Initiative in spring of 2020, right after COVID hit in deep East Oakland. And Dr. Kala joined Umoja and co-led Umoja Health of San Mateo County with Ms. Lisa Taylor starting in March of 2021. And its central principle is the For Us, By Us model.
We're a youth service learning organization in the Mid-Peninsula communities. Our purpose is to bridge communities through service-based, youth-led projects and to help build lifelong leadership skills that transform community relationships. Creating opportunities for youth to learn leadership by engaging with critical issues in their communities. Some examples and people that we work with in our youth community are Learn Commission to recommend anti-racist policies, and there's Youth Connect, which is mental health awareness and suicide prevention, and then there's Umoja Health, which is community engagement through vaccine outreach. This is a picture of all of our youth community that helped with Umoja this summer. There's me, Isabella at the front, and then Elena, Alec, Fiorella, Azaria, Diana, Helen, Ambry, Dahlia, Rose, and Sophia. And on the side we have some graphs and percentages of some of our personal information.
So for our program statistics, we volunteered for a total of 530 hours. We've met 27 times throughout the summer program, and we have 11 volunteers. For our summer program, we had 6 weeks of helping the community.
We volunteered at lots of different places, including the COVID-19 vaccine clinic in East Palo Alto, different food distributions, farmers markets, and we met on Zoom, as well as our home base at the Ventura Community Center.
The things we did during the program were conduct surveys about COVID, inform people, and gave flyers and phone calls to let people know where our vaccine clinic is and how to get or where to get their vaccine. We participated in a week-long health training practice for the leaders to show us what to do for the summer program.
We also went door to door in the community to inform people about COVID, and we helped translate for patients getting the vaccine, as well as helping run the clinic. Now we're going to do an introduction into the surveys. And we start off with what is the intent of the surveys that we are distributing. So the introductor of the survey is Dr. Kala, who's an epidemiologist at UCSF, and she brought the survey to East Palo Alto. The intent of our surveys is to put healthcare equity into motion by determining the underserved areas of our community, and we aspire to effectively communicate to our Umoja partners the areas that need resources and aid through the comparison of our survey results.
Now we will be getting into the next question, is how is our data being used? So we collected some information, and I will be reading it out to you. So comparing and collecting data tells the difference between which communities have more or less access to COVID-19 resources, and technically expanding the knowledge of COVID-19, wider range of samples, surveys that reveals trends in the data and provides answers for where more resources and aid should be provided.
When looking at some of our results from our surveys, you can see that within the gender demographic, females were the most respondent in our surveys in comparison to males and non-binary individuals. And then within the age demographic, the age range that we received the most responses from were individuals that were 35 to 44 years old.
And for the question, is the pandemic over? We have about 81% said no, and about 11% said yes, and about 9% said maybe. And is COVID like the flu? Majority of the surveys said no, and about almost half said yes, and we're in the middle, maybe like 10% said maybe.
And when asked whether participants will continue to wear masks, a majority responded yes to wearing their masks inside, and for the answer to masks outside, there was less individuals who responded with yes, but it still remained the majority. When examining our survey results, some peer leader observations were that individuals who were less informed of COVID-19 and had less knowledge regarding pandemics, they were more skeptical of vaccinations and the extent of the virus. And peer leaders also observed that when individuals who were being surveyed, when they were reassured that their personal information was protected and that their responses would be anonymous, they were more likely to respond.
Giving people information about the COVID clinic who didn't know they had access to. Teach people that there are other backgrounds, which is a humbling experience. Inform people that we have free vaccines and getting more people vaccinated. Giving UCSF info and better inform them about the public health. Improve communities' awareness and learning about COVID-19.
We were able to help the community. We've all strengthened our communication skills. We all worked amazing as a team. I can speak for most of us and say that we all gained confidence from this and we have less anxiety. Overall, we built relationships with other peer leaders from different backgrounds, which is refreshing.
So some program successes is that information on COVID vaccines are more accessible to the community members of East Palo Alto, and that led to the vaccination rate going up for their city, and we got a total of 805 surveys completed.
For the program reflection, some improvements to be made are like more events for peer leaders to earn more hours with like the ending of the program. If there's a cancellation on an event, then there should be backup work for us. And a good thing about this program is getting to make new friends and being able to socialize with them and the good coordinators of the program. That's the end. Thank you.